Welcome to Age Hackers, powered by Gladden Longevity with Dr. Jeffrey Gladden, where our passion is to help you live young for a lifetime. On this show, we want to help you optimize your longevity, health, and human performance with impactful and actionable information by answering 3 questions. How good can we be? How do we make 100 the new 30? And how do we live well beyond 120? I'm Steve Reiter and Dr. Gladden. We just wrapped up with Dr. Alan Bauman from Bauman Medical Center talking about hair loss. And preventing hair loss.
It's a conversation I should have had 40 years ago, apparently. But
he said there's hope for you. He said there's hope.
I know. But I think the audience is going to find this really fascinating. It's one of the more in-depth conversations I've ever had with anybody about hair. And the way that he actually deconstructs the problem and goes through it, everything from simple things to right up to the latest technologies in hair transplantation, and many, many layers in between there of things that can be done that are extremely helpful. I think if anybody has, male or female, if anybody has any concern about hair, this is a great show to listen to. So
one of the things that Dr. Bauman had mentioned before we started recording is he said 50% of his patients are female.
That's right.
I never expected that. I expected there to be, definitely a representation of females that would come in, but for 50% means that it's a much bigger problem. And so for women listening, really take a listen to this, because he covers not only hair transplants and other cutting edge ways using PRP and peptides and all these things to help get your scalp healthy, but then also a rigorous preventative regimen.
Exactly. And we talked specifically about the issues related to women's hair loss, which are different from men's, right? They can overlap. They overlap, and we'll talk about that, but there are some very specific ones. And it's a really great podcast. I think you'll really learn a lot from this. So welcome, everybody, to this edition of the Gladden Longevity Podcast, the Age Hackers Podcast, powered by Gladden Longevity. I'm your host, Dr. Jeffrey Gladden, and I'm here with Steve Reiter, as usual. Steve's in Colorado Springs. Steve, how are you doing?
I'm doing really good, Dr. Gladden. It's another beautiful day here in Colorado. Went out for a nice 1-mile walk to catch some early morning sunshine, and had a good workout this morning. How about you?
In
Puerto Rico.
Yeah, things are great. I've been here for the last 3 weeks straight. I've really kind of pushed into getting my workout routine back under control. So I've been doing the VASP for 3 days a week.
Ooh.
And I've also been mountain biking more frequently. And today, when I started, there was a certain mountain bike trail here that was difficult. I was having trouble making it up certain things, but 3 weeks later, I cleared the entire thing today. And it's really fascinating to me how quickly your body will respond when you're putting together the right cardio with the right sort of blood flow restriction, interval training, and you get those pieces dialed up, and it's remarkable. So I'm feeling like I had lost some ground with all my travels. You go for runs, you work out in the gym, you bring resistance bands with you or whatever. But being able to really lock in a schedule and commit to that it's really been so fun and nice. So I think by the end of the summer, I may hit a new VO2 max record. My record right now is 198% of predicted, which I did a little while ago. I was in an excellent category for somebody in their 20s. I think I can beat that now. So anyway, that's the goal. So things are good.
Nice. Well, we have an incredible guest today that I'm excited for, talking about hair loss. For both men and women.
Yeah, men and women, exactly. I think I'm a lost cause, but that's okay. And but we have with us really one of the world's foremost, I think, hair specialists, if you will, transplant specialist, hair care person, I'm sure. So Dr. Alan Bauman, welcome to the show.
Thank you so much. Jeff, it's great to be with you, and Steve as well. Great to be here.
Yeah, absolutely.
And you're not a lost cause, but we'll get to that.
Okay. So anyway, I have made peace with my bald head. I'm totally cool with it. Anyway, beyond that though, you got yourself into hair. So how did that happen for you? What's out of medical school, not everybody wants to jump down that pathway. So what took you there?
That's true. When I entered medical school and even my internship and residency, I wasn't thinking at all about hair transplants. I was being mentored by a plastic surgeon from the time I was a teenager, and I just expected that that would be the path that I would take, that I would
Okay.
go through into cosmetic or reconstructive procedures and treatments. And of course, I was being mentored, and I got a chance to see some amazing, life-changing restorations on the cosmetic side of things.
Mm-hmm.
And it wasn't until I met a patient who had had a hair transplant that I even really think about hair transplants as a viable option. In
Okay.
the mid 1990s, remember most hair transplants kind of looked pluggy and
Yeah.
honestly were pretty painful. And
Mm-hmm.
I was just of the mindset that, it didn't seem like a viable cosmetic procedure. But I met this patient whose medical history led me to believe that he had had a hair transplant. So I got into a discussion with him about it. And, it was kind of a funny conversation. I said, well, where did you have your hair transplanted? And I was thinking he was going to tell me, where on his scalp. And he told me, oh, well, up in Toronto. And I thought that was interesting too. So we got a little chuckle out of that. But
Nice.
one of the things I remember most about that conversation with him is number one, the fact that his results looked amazing, completely undetectable.
Mm-hmm.
And he told me how that got executed with single follicle implantation, which was totally different than the pluggy process that I
That's
was
right.
accustomed to seeing.
Yep.
And the other thing that I remember vividly was how his life was changed from the hair restoration procedure. And he described how socially and professionally it led to doors opening that he felt were
Mm-hmm.
closed. And it really transformed his life from that point forward. So
Yeah.
I had this new kind of starting point, if you will, about hair transplants. And I figured I would start to look into it. And then, of course, that led me down the path of research and reading and then traveling conferences and visiting different hair transplant surgeons around the world, around the country for sure,
Mm-hmm.
and seeing what was possible with the new techniques of single follicle implantation. Now, of
Right.
course, at that time we were still taking the old-fashioned strip harvest out of the back of the scalp, but
Okay.
I felt that I could add that to my repertoire of cosmetic surgery procedures and plastic surgery reconstruction. But after about a year of fellowship training on that, I decided to just jump in full tilt. And
Okay.
that's how I ended up moving to Florida, opening my practice. My wife and I packed up the car. We were engaged at the time, and I
Right.
moved to Florida, to Boca Raton, to open up a hair restoration clinic.
Okay.
And it seemed like a quick 25 years.
Yeah, exactly. It goes by in a nanosecond, doesn't it?
Absolutely.
Yeah, very fun. Well, that's cool. Well, it's fun. It's really always fun when you find something you're passionate about, something that you're good at, something that you can actually sort of take and actually refine, make your own, innovate with. And you've done a lot of innovation in this field. Do you want to tell us a little bit about some of the innovations that you've brought to it? Because to your point, when it first started, when I first saw hair transplants, they were always so detectable, right? It looked like some guy had a bunch of plugs stuck in his forehead, and I don't know. I think it was. Well, I'm not going to say it was a worse solution than the problem, so to speak, but it wasn't a whole lot better in a way. So
Sure.
yeah,
I mean, what's amazing is that even the guys that had those old plugs, they
yeah,
loved them. I mean, it gave them
yeah,
something to comb in an area that they didn't have anything before. So
yeah.
even though it didn't look so natural, it certainly changed their lives in a positive way. But obviously, it did not look like Mother Nature's hair.
That's right.
And so I wouldn't say I invented an artistic hair transplant. Of course I didn't. My mentor in plastic surgery said, well, if you want to learn how to paint a tree, you better go out to a forest and study what trees look like in nature. And
Mm-hmm.
he carried that through, whether it be a nose job or a facelift or an eyelid.
Mm-hmm.
And certainly I always thought about that when I was creating hairlines, even in my early days. What does a normal, natural hairline look like? And can I control the angle, orientation, and position? So it's not really, an invention, but I did pay a lot of attention to the artistry.
Mm-hmm.
And I still think today hair transplant is 90% art. And, when people travel to various places, even in this country and also around the world, sometimes what's lacking when you get those less expensive hair transplants is the artistry. And you end up looking like something that was a cookie cutter.
Mm-hmm.
And we try to guide our patients away from that cookie cutter approach into
It's kind of
something
like
more
the
artistic.
classic nose job, right? Where somebody comes in and all of a sudden they've got kind of a, I don't know, standard sort of ski shaped nose, or I don't know how to describe it, but it's, if you see that nose, it's kind of like it looks like it was a fixed nose or a done nose or a whatever nose, right? So, yeah, to your point, I think making it natural, and then you've got so many different hair types, right? Curly hair, straight hair, different natural hairlines based on races, I'm sure, Asians versus
Absolutely.
Caucasians versus darker complexions, Native Americans, whatever. Yeah. So
100%. So you've got, the hairline shapes and designs are unique and individualized, and ethnicity plays an important role, looking at bone structure and muscle structure of the face, and how the hairline should naturally reframe the face, but not go too far because, you want something that we say is age appropriate. So I always thought that there was a less invasive way to do the procedure, even when I was in my training and we were taking those strip harvests and closing those areas with scalpels and stitches and handing off the tissue to a team of technicians to do the dissection of the individual grafts. I always thought that there was maybe there's a better way, and it was my exposure to laparoscopic surgery in my surgical residency that led me to believe that a minimally invasive approach would be better off for the patient in a number of ways. So as I started to learn that people were traveling around the world looking for less invasive hair transplants, I started to tool around literally with different instruments to try to figure out, how do we get these follicles out of the scalp? And I can't say, again, I didn't invent the process, but there's about 6 or 8 of us around in the world that were at the same time working with these small instruments, basically like just small needles, to try to extract the follicles one at a time. And so that led us to the FUE, or Follicular Unit Extraction approach. And so that was a big game changer for the industry.
Right.
I actually developed the first consumer, or I should say, first available commercial device. It was a handheld manual rotation tool called the Mindex for manual extraction of the FUE grafts. And a lot of people don't know that. And it wasn't all that fast or efficient by any stretch of the imagination, but it was our first attempt at refining an instrument to allow us to get those follicles out one at a time, or at least the groups of follicles, 2s and 3s or 1s at a time, without a linear scar.
So I'm curious about the harvest. So with this technique, I assume that you're harvesting from all over. And just so the audience understands, there are parts of your head, and I'm not a hair specialist here, but there are parts of your head where, let's say, male pattern baldness is much less apt to affect, and there are other ones where it is apt to affect. So if you're getting a hair follicle from an area that's likely to be affected 5 years from now, and you put it into a place that's affected currently, the duration of that may not be as good as you want. As I'm assuming, you probably have to go other places to get more durable hair follicles potentially. Is that kind of part of the idea, or what's happening?
So yeah, let's just take a step back and look at male pattern hair loss. Male pattern hair loss starts at the hairline, it recedes the hairline, and then you have some thinning in the crown, and it can continue across the top of the head. But what you realize, even extensive male pattern baldness spares the sides and the back of the scalp.
Right.
So our occipital zone is privileged. It's immune to the body's hormones. It's immune to the effects of DHT, dihydrotestosterone. And those follicles, once removed and replaced into a new zone, retain that property. So they live and grow there in the new location forever, really a lasting result, unless there's other metabolic issues, of course, but they're going to be resistant to DHT in the new locations. So we definitely want to be harvesting from those side and the back of the scalp, that safe donor area, and there's some specific ways to assess that microscopically to make sure that we're in the right location.
So microscopically, what are you looking for? Are you looking for hair follicles that are not kind of miniaturizing? Is that part of it?
Yes. Yeah. I mean, one of the interesting new technologies, I just spoke with a software hardware developer out of Germany, and what they have is a tool that enables us to take pictures of the scalp and assess the donor zone and make sure that you're in the correct area. Now, of course, a trained surgeon, I've been doing this for 25 years and treated over 30,000 patients. I can identify those areas that are safe by looking at the scalp, making sure there's no level of miniaturization or weakening effect of the hair follicle function in the area. So we make sure we're in the safe zone.
Got it.
So there are anatomical signs and such.
Yeah, let me ask you this also. Has it gotten to the point where harvesting can be done on some level robotically, or with some sort of AI program machine that can go in and kind of do something, some of the artistry, so to speak, or is that still a ways away?
Well, no, there are a lot of AI applications in the world of hair loss. We have an AI-powered microscope that can count hairs and quantify the hairs based on their caliber. And we do that for diagnostics and for tracking. Right in a consultation, every single patient that comes into the office So neglecting those who have gotten a virtual consultation, if you're here, you're going to get that technology. The ARTIS by Restoration Robotics is a tool that was FDA approved in 2011. The ARTIS hair transplant robot is an exciting development. I own one. It is the most sophisticated semi-autonomous surgical instrument on the planet. And it was certainly a big part of the practice a number of years ago. However, we've learned over the years, and so what ARTIS would actually do is assess the donor area and make a judgment call on the angle, the orientation, the position of the follicular unit or those group of follicles. It would make an extraction approach, and then we would manually pluck the follicle out of the skin once the excision site was made. So pretty exciting. It was a fast tool. It was a pretty accurate tool. Unfortunately, I feel like that tool, at least in our hands, has not kept up with our manual instruments. So our manual devices, which have become a lot more automated, not necessarily AI powered, but more controllable and a smaller tip, allowing us a more minimally invasive approach, has kind of superseded the robot in many different ways. The robot is not an ideal device for every single patient, certainly. And just over the years, we've used it less and less and less.
Interesting. So
yeah, but it is a cool tool. I mean, it's an exciting technology.
Yeah.
I'm a huge advocate for any kind of gadget that can help us do our job better.
Sure.
And, AI helps us with that evaluation process. Like I said, with the photography every single day, it helps us with looking at genetic tendencies towards hair loss and evaluating our genetic code for metabolic pathways that might influence hair loss and what treatments might work better. So AI is a big part of our practice for sure.
Yeah, nice. So you were talking a little bit about evaluating the hair follicle in terms of its direction. And I'm thinking that, hairs tend to grow in a particular kind of way. They don't just go straight out, right? They kind of go in a different way. So if you're gonna use a follicle, I can imagine if you put it in the wrong direction, you're going to be growing bangs instead of something else, or something's going to be a little wacky about it. So is that like a really big deal? Is this part of the artistry that goes into all this?
Yeah, you've nailed it. That's a super big deal. So whether we're talking about just a simple area like the crown appears simple, but it's not. It's a swirl.
Right.
And so if there's some hair in the area, you have to angle the instrument for the recipient site parallel to the existing hairs. So that means creating literally a swirl pattern based on, Mother Nature's natural swirls or arc patterns.
Right.
And then as we get closer to the hairline, if there's any clue that's left behind from the miniaturized hairs, we want to use that as a guide. But of course, designing a hairline from scratch, as I would do for you in your case, we'd have to rely on my years of judgment and artistry that I've developed in creating it from scratch, creating the correct angle, orientation, position of each individual hair, as well as the correct shape and frame of the face that's going to be appropriate for you,
right,
based on the amount of donor hair that you have available around the sides and the back of the scalp, and maybe alternative sources of donor, like, for example, your beard or chest hair or body hair that we could also add.
Interesting. So I didn't know you were actually going off the scalp to actually harvest hair too, but it sounds like you can do that too. Interesting.
I mean, if you told me 15 years ago that I'd be harvesting beard and putting it on people's scalp, I would never have believed you. Right. But the technology enables us to do that today, and we do it very routinely. I don't think there's a week that goes by that we don't do beard to scalp. Yes, Steve.
So Dr. Bauman, my beard hair feels very different than the hair on the top of my head. It just feels very different. How does that work then?
Yeah, well, for many patients, it is very different in terms of its coarseness, its caliber, its color, the how many hairs or follicles are in natural paired or groupings may be different in those areas. So we have to use the beard very carefully and assess whether it's similar or different to your existing scalp hair. Now, of course, if you've had multiple procedures, you're donor depleted, maybe you have old style scarring left behind, the beard can be your lifeboat for covering those old scars or filling up areas, especially if you've been told that you're not a candidate for hair transplants anymore. The minimally invasive style enables us to take those follicles. Now, maybe we wouldn't put them in the frontal part of the hairline, for example, and we certainly don't want to create a patch of beard, in your temples or something like that. But we can pepper them in as a good donor supply in those recipient areas to create the fullness and the coverage that we want, kind of as a stopgap.
Interesting. Yeah, very interesting. So let's talk a little bit about men and women, and let's talk a little bit about hair loss in the first place. We've talked about a hormone, dihydrotestosterone, DHT, which is a metabolite of testosterone, which hair follicles in men with male pattern baldness, which we inherit through our mom's side, quite honestly. My maternal grandfather was bald. At least that's my
Or dad.
or dad. Okay.
You can inherit from both sides for
Okay. Well,
sure.
I had it coming to me from both angles then. But anyway, so, the hair follicle becomes sensitive to DHT. And I know for me, it started to happen really kind of in college is when it first started to become apparent. And then it goes on for a number of years. The same can be true for women. They can also have hair loss, but talk to us a little bit about the differences or the similarities between men and women in terms of, hormonally mediated hair loss. I know a lot of women, when they go through menopause, seem to start losing hair. Or with hormone replacement, sometimes they'll complain of hair loss or lack of thyroid or lack of enough estrogen or progesterone. That can contribute to it as well. So it's kind of a complex little soup that you've got going on there. Can you help break that down a little bit?
Absolutely. As you know, it's always more complicated when we're talking about the females.
Well, there you
100%, no matter how that conversation goes. But female hair loss looks different than male pattern hair loss. So as we mentioned before, male pattern, you could see it from across the room pretty quickly. It's a receding hairline, maybe a bald spot developing. For women, it's still affecting the frontal area, but it's more of a diffuse loss. Mm-hmm. What I've seen is that it spares the hair on the sides and the back. So generally that density and quality is pretty good, but they're losing a diffuse amount of hair in the frontal zone. It can happen anytime after puberty, just like in men, but it typically happens a little bit later in life. And so it could be around the time before they get pregnant, if they have a PCOS or polycystic ovarian syndrome, which is a high androgen sensitivity kind of syndrome where you have acne and hirsutism, weight gain, and hair loss all combined. Many times it happens around the time of childbirth. And so once a woman gives birth, hormone levels drop severely, and that can cause some significant shedding because when the hormones are raging during pregnancy, the hair follicles respond and grow thick and healthy and shiny. And that may also be from some of the let's just say shared exosomes between the baby and the mother as well that pass through the placenta. So there's a lot of symbiosis there. Just like her skin looks better and so forth, her hair gets better as well. So there's some cross contamination there, if you will, from the fetus. But also, as you mentioned, during menopause, perimenopause, as hormone levels start to change, so can hair growth cycling. And so women can often see thinner, weaker, wispier hair. They can see more excessive shedding without replacement of their existing hair. They can see changes in hair texture and, of course, hair color, just like in men as well. In severe cases, it can recede the hairline in the temples, and very often we see that in women who are androgen sensitive. And so if a woman goes on hormone optimization therapy and is replacing testosterone, even just a little bit, many times if it's overshot, they can actually start to recede the hairline if they have that tendency towards female pattern hair loss. So we like to take a very holistic approach when it comes to both men and women. We're looking at risk factors and lifestyle, because everything from nutrition and diet to stress level and sleep-wake cycles, all of that can dysregulate hair follicle function. And you throw on top of that dysregulation of the hair follicle from infections, like we've just recently been through a global pandemic, or at least that's what they say, as well as the mRNA vaccinations, spike proteins that can also dysregulate the circulatory system and trigger autoimmune issues. You mentioned thyroid imbalance. What can cause thyroid imbalance? That list is very, very long.
Sure.
So too much thyroid, too little thyroid can affect the hair follicle function. So we have a lot of work to do on the integrative medicine side of things to really dissect into what's going on with the female hair follicle. It's not just so simple and cut and dry.
I would think that'd be critical, because if you are going to counsel somebody on maintaining their hair, then obviously getting those, we'll call them functional medicine elements, correct, obviously may help them avoid the need for a hair transplant, for one thing. And then the other thing is, if they are going to have a hair transplant, you want to take good care of what you just spent time, attention, and resources putting in place. So not subjecting it to all the stressors, we'll call it, that caused problems in the first place would be massively important. So do you have like functional doctors that you work with in your clinic, I would think, or PAs or NPs or something? Yeah.
Yes, so I have a functional practitioner and his assistant, as well as someone specifically for fitness and nutrition in we call it Bauman Performance Program. And so oftentimes hair, as a highly metabolic organ, it has the highest mitotic rate of any cell population in the body. It's a very, very sensitive barometer to your health and wellness. And so over the past 25 years, we've uncovered a lot of dysregulation of all kinds of metabolic systems. And so, and oftentimes when I've referred those patients out, they didn't really get the care that I thought they deserved. And, in my network of, being a member of the American Academy of Anti-Aging and Age Management Medicine Group and other, kind of integrative medicine groups, I felt like locally we had to go beyond just the primary care. And so we're not replacing their primary care doctor, of course. They may have an OBGYN, an endocrinologist, a dermatologist, but we have, being an integrative practice here inside Bauman Medical, we can look at a whole variety of organ systems and functions and do different biomarkers and testing and take someone from that point of dysregulation into better regulation, if you will. So optimizing, not just getting to a wellness point so that their hair will grow, but then we can also take it further, optimizing them. And if it's hormone optimization with peptides and so forth, supplementation, and then take it even further into longevity, that's really where, I'm interested in pushing the envelope there, as well.
We've been involved with a product that can re-lengthen telomeres and is reportedly very effective at regrowing hair. We haven't been using it for that per se. We've actually been using it to help people recover from things like COVID or vaccinations that shorten telomeres, or people that just show up with short telomeres from their highly stressful lives or whatever else. And we've had really, really nice success with that. But some people do report, improved hair growth with it. It's something that can be applied topically or taken orally, which is interesting. We might talk about that. But do you go as far down the longevity pathway as measuring telomere lengths, or is that something that's a little bit beyond the scope of what you do?
No, for sure. Like, we're going to look at epigenetic factors. We may do DNA methylation testing, life length, obviously look at telomeres and such. I know you mentioned VO2 max. We'll have the ability to do that. This is a relatively new project, so just within the past year, it's been launched. But we have all of the different, everything from, even grip strength. I've got, ways to measure what's going on. So, my Joe is my functional medicine practitioner, and he's amazing. His background is OBGYN endocrinology. So he's tackled the hardest female endocrine situations that you can imagine, from thyroid on up, PCOS and so forth. And so the men are easier. There's just, less switches and buttons to switch, so to speak. But we like to take a very holistic approach, even down to the health of the scalp. I'm very keen on scalp health. And so I have an entire department. If there's inflammation, itching, oiliness, or something going on, I want fertile ground for those follicles to thrive. As we know, the niche of the hair follicle is not just the follicle itself, but it's also influenced by the adipose tissue, by the circulation, even the nerve endings and the muscles, the erector pili muscle that's attached to the follicle, and it's uniquely wrapped around with the sebaceous glands and such. So all of these factors need to be kind of addressed in most patients. At least keep an eyeball on those factors, especially if we're going to do some degree of regenerative treatment, like a PRP or something like that on the scalp, or exosome therapy or something else. And of course, if we're going to do transplantation.
Sure.
This episode of the Gladden Longevity Podcast is brought to you by H2 Molecular Hydrogen in the Gladden Longevity Store.
Yeah, Steve, you've heard us talk about this numerous times on the podcast in terms of the benefits of H2 and hydrogen water. We love it. It's really the best way to balance your entire redox system. So it really protects you from free radical damage. I take it every time I get on a flight to protect me from radiation damage when I'm flying. And I use it to rejuvenate my brain in the afternoon. There's really two kinds of exercise. There's physical exercise, and taking H2 before or after that works great. But also there's mental exercise. And I find that the H2 will bring your brain back when you're tired in the afternoon. So I think it's like the perfect thing for longevity and for performance, quite honestly.
And I talked to you about this, that I found dropping 1 or 2 tablets in a glass of water right before bed. I've seen an overall bump in my deep sleep when I do so. And
fascinating.
yeah. So if you click on the store tab when you visit GladdenLongevityShop.com and use the promo code podcast10, you'll get 10% off your order. And this code isn't only good for our H2 product, but it's also good for all the supplements we carry. So podcast10 at the GladdenLongevityShop.com.
Yeah, one of the other things that I use it for routinely is when I'm about to go on a mountain bike ride. And I will say this, that if I go on a long mountain bike ride, I will take one prior, I'll take one during, and I'll take one after. And some of the Ironmen that we've worked with have said that when they're doing an Ironman, they'll take it 3 or 4 times throughout the race. And their comment is that it's like taking out the old battery and putting in a new one. It really rejuvenates your body's ability to perform when you're doing more extended athletic activity. So think about that too. If you want to go do a longer hike or whatever else, take it with you.
So GladdenLongevityShop.com, enter podcast 10 for 10% off your order.
H2 molecular hydrogen. It's low-hanging fruit on your quest to make 100 the new 30. Let's talk a little bit about therapies, because they really run a gamut from snake oil to things that are incredibly effective. And maybe we'll start off with, what are things that people can do to actually take care of their hair in the first place, right? How do they manage that without needing to see a specialist or whatever? Let's just start with some generic information and we'll work our way through to somebody that's actually going to have a procedure done.
Sure. So, the first thing to think about, if you're worried about your hair, either you're seeing shedding from something that's maybe happened to you within the past 6 weeks, a perceived stress or actual physiologic stress, there is a chance that might rebound and just, go away, and that your hair might regrow. Mm-hmm. Obviously, if you're a male patient or out there, just past puberty, obviously you're in either high school, college, or, beginning your career, something like that, and you're seeing a receding hairline, early treatment is what's warranted. So you don't want to really waste time with shampoos and vitamins and things like that. If you've got a receding hairline, you got to get on top of it. So you've got to see a specialist. So there are things that we do kind of as a basic, plan of action. So the scalp health is something I mentioned, getting a handle on those lifestyle factors, good nutrition, because the hair follicle, we're going to probably spend about an hour talking today. During that time, every single one of your listeners who has a healthy head of hair has already grown 5 to 6 feet of hair on their head.
Wow.
Now, Jeff, you're going to be excluded from that category.
Yeah.
But a healthy head of hair is a highly metabolic cell population, as I previously mentioned, and there's a lot of metabolic commitment, energy commitment, nutrients, and fuel. So if you're protein deficient, or if you're mineral vitamin deficient, you may not grow hair. If you're a woman and you're anemic, heavy periods, your cycles are being dysregulated, you're not going to grow good hair. So you've got to get your health and wellness organized first. And there's a lot of hacks to do that today. You can get an Oura ring to look at your sleep cycle. You can, do a saliva testing to see if your cortisol levels are continually elevated through the evening. So there are things that people can do on their own. But I want to make sure that people understand that early treatment is certainly the best treatment. Mm-hmm. And so even if you were here in the office or we were connecting virtually, we'd be talking about all of that holistic approach. And I'd be asking you about any health factors, medications you might be on, risks in the family, and your hair styling habits. Women that use tight braids or hair extensions can put themselves at risk for traction alopecia. So you want to avoid those bad habits.
Okay, just putting too much traction on the hair follicle itself, too tightly stretched or pulled. Yeah.
100%. Over time, there are ethnic populations that do tight braids for their young girls. And by the time they reach high school, they've got a receding hairline. Mm-hmm. And some of those follicles are beyond repair. So it's really important not to torture or put too much attention on those hair follicles. Mm-hmm. And we see it with wigs and weaves, and even guys that wear hair systems. Their attachment methods can be detrimental to the hair follicle in those areas.
Gotcha. Okay, so that's some good advice for people. And really, taking care of your underlying health is really the message here, right? Whether it's insulin resistance, metabolic health, whether it's hormone health, thyroid health, stress levels, all those things need to be addressed, right? It's kind of like taking care of any other part of your body. And with the high metabolic rates of the hair, it's somewhat accentuated there. So that's first. So then the second thing is this interesting concept that you have about people with early hair loss should get in front of it. Do you want to talk about that as opposed to people, reaching for the minoxidil or the, finasteride or whatever else, or how does that work together for you?
Yeah, well, like early male pattern hair loss, needs intervention, needs treatment. If you're going to fight the fight, we got to get on it quick, because once the follicle is too far miniaturized, right? Because the follicle is affected by DHT, it's going to weaken, it's going to shrink, it's going to miniaturize, and the hair cycles are going to decrease. So what was normally a thicker, longer, stronger hair that was being produced by the follicle now is a thinner, shorter, weaker, wispier hair with each successive cycle. And once that cycle goes down to producing a hair that's 2 millimeters in length, and that's it, and maybe 30 microns in diameter, all of a sudden that we don't have a treatment to fix that, to make that follicle better. So we have to take action before we get to that point of beyond no return. Now, maybe sometime in the future, somebody will learn how to activate those hair follicles that are growing a 2 millimeter hair, but right now, that's not going to happen. So if you've got hair that looks like the hair on your cheek, vellus hair on your scalp, that's not coming back without a transplant. So get on it. So what can we do? So we've talked about for patients, there may be pharmaceutical interventions, so ways to decrease DHT production with finasteride or oral medications like saw palmetto. There are topical things that we can do. If you don't want to take finasteride orally, you can use topical finasteride. Minoxidil is the other FDA-approved medication that's been around for a number of decades now, right, as a form of Rogaine, although that's kind of greasy and gooey. We have more compounded, less greasy, less gooey, more easy to use, consumer-friendly versions, scalp-friendly versions of that are going to be more powerful. And you can also use minoxidil orally. Microdosing minoxidil can actually have a very powerful effect on hair growth in both men and women. And it's very, very low risk to do low dose minoxidil. But a lot of folks are just not into taking medication. So then we can step into other things. Again, we've already talked about nutritionals and keeping the scalp healthy, of course, but let's move into something like red light therapy and photobiomodulation. We know red light therapy today is a very effective hair growth treatment, and we can say that with good confidence. We've used it in the office for over 2 decades. We have now thousands of double-blind randomized clinical trials in the published peer-reviewed literature. We have meta-analysis of those clinical trials, so we have the best evidence possible to show how good red light therapy can be. But so
let's talk about red light for a second, because photobiomodulation is really powerful in lots of different areas, right? So we can use it to help with pain and joint repair. We can use it on the brain, using it on the hair. So when we think about some of those areas, what we think we're doing is actually improving mitochondrial function, energetics, and things like that. So is it the same thing here with the hair, and how is that working in the face of DHT sensitivity and other things? Can you talk about that?
Sure. Well, making the follicle more resilient, more resistant to DHT is the goal. Obviously, if we can eliminate the amount of DHT in the area, that would be great. That's like taking your foot off the brake and then pushing on the accelerator is the other thing we need to do, right? If we want to move the car forward. So as you mentioned, we know now that we did not know 20 years ago that red light is absorbed by the mitochondria. It hits a cytochrome C oxidase in the electron transport chain, and we get the production of ATP. We know also it can increase blood flow. It's very well documented, and decrease inflammation. And so all of those things are excellent at the level of the follicle, because a follicle that's miniaturizing, even due to male pattern hair loss, has some microinflammation. There's a cohort of lymphocytes that are circulating in and around the base of the follicle. And so mitigating inflammation is important. And that's probably why some of the early treatments with anti-inflammatory corticosteroid injections for both men and women actually did have some efficacy. But the red light is something you need to apply daily. So we have devices now that you can use at home 5 minutes a day, like the turbo laser cap. It covers from the hairline all the way through to the nape of the neck, and it's portable and rechargeable. And this is not going to be your Amazon, laser helmet. This is not a consumer device. This is a medical grade device, basically re-engineered, reinvented by myself and the inventor of the original laser cap, Dr. Michael Rabin, out of Cleveland.
Got it. Okay.
And we prescribe a ton of that.
Yeah, nice. Yeah, I would think so. And I would wonder if it's something that you would prescribe after a transplant or a PRP procedure or something, because you're trying to, in our world, we're basically trying to stack technologies to kind of boost things in the right direction. I suspect the same is true for you.
100%. So we've had in-office laser devices, like I said, for over 20 years. 1998, I received my first laser device. I was dead set trying to prove that it didn't work, that it was a snake oil treatment, and the more people I treated, the more hair I grew. So I became a firm believer.
Nice.
And did a lot of those original studies. So, yes, we laser every person for 15 minutes prior to surgery. Every post-op visit, they get laser treatment, 15 minutes, total scalp. The follicles, as they're sitting outside the body in a very special solution at 4 degrees centigrade on a cooling tray, that, guess what? They're bathing in red light.
Okay, nice.
So we're very keen on that, and we use a lot of red light in conjunction with my scalp clinic for various forms of scarring types of alopecias and things like that, maybe beyond the scope of our discussion today, but, also are out there in the world of hair loss.
Yeah. Okay. So let's say somebody's done these things and now some sort of a procedure is going to be required. So I've seen people do some things related to microneedling, some things with different peptides like GHKCU, I think I've seen, maybe BPC 157 associated with it. Then there are people using PRP, platelet rich plasma. Then you've got some people are using stem cells, mesenchymal stem cells, in conjunction with PRP and peptides. And then you've got people that are doing hair transplants. So just walk us through kind of that whole garden of opportunity for people.
Sure. I mean, obviously, transplantation is a different animal. We spent a little bit of time talking about how we minimally invasive approach to that process, and no scalpel, no stitch harvesting, and retransplantation artistically. But I think what you're aiming at is, what are these regenerative treatments that we can do in the office?
Yeah.
And we've done over 12,000 PRP treatments for hair regrowth. And today, I could throw a rock from my clinic, and there are a dozen other clinics that provide PRP for hair and skin and everything else you can imagine under the sun. But the problem is that most physicians, most practitioners, most medi-spas have no clue what the dosing strategy should be for platelets. So I'm just going to start right there. What we've determined is that there's a specific dosing strategy in order to get PRP to work at the level of the scalp. And so there's a production component. How many platelets are we delivering? What's the dose of platelets? What's the concentration? How we deliver it is really, really important into the scalp. And then as a follow-on, there's other additional things that we can do. So PRP, platelet rich plasma, I'm sure your listeners are very, very well versed that know that it's a blood draw. We take about 60 to 70 cc's of blood, and we use a dual spin protocol to concentrate and extract platelets, but also some white blood cells too. We want to get 10 to 12 billion platelets in the final product of 7.5 cc's. So in order to get to 1.5 million platelets per microliter, that's the dose, we have to do something very special. And you cannot do that with a single test tube spinner with a little gel separator. No way can you get that. You're only going to get a doubling at the most. And sometimes you're not even going to harvest all the platelets. They're going to get lost in the gel. So if you've got a little tabletop spinner, you might be able to do some wound healing. You might be able to do some skin rejuvenation with that. You might be able to do some microneedling and such, but that's not going to trigger platelets, at least in our hands. What we've seen, single dose, single treatment, that's going to work for 10 to 14 months.
Nice. So do you actually spin the sample twice with this dual spin?
Sir.
Okay.
Yes, sir, we do. It's a dual spin process. So the initial spin is a slower spin that takes out the red blood cells and leaves us with a platelet suspension. So the first spin, you get the 2 layers, but not 3. You get the platelet suspension up top, and the red blood cells are heavier. We take those out. So what's left at the top is a platelet suspension along with some white blood cells. And we spin that. We spin that hard. So what that does, it takes every platelet and pushes it to the bottom. And above that pancake of platelets, we're taking out the PPP, platelet poor plasma. We want to get rid of most of that. We can use that as a lubricant, but what we're aiming for is to get to those 10 to 12 billion platelets in the final product.
Nice. Yeah, that's interesting. And then I'm sure there's artistry and technique in terms of how those get administered, in terms of how close to each other the injections are, how that's working.
And the depth. and the depth. So
really?
every single patient gets a ring block. So just like what we do for transplants to produce a painless procedure, they're going to get a local anesthetic block, which is going to basically put the entire scalp treatment area to sleep. You're not going to feel any bit of those injections, which, as you say, are carefully administered.
Yeah.
And then we can add other things to it. We can add in polydioxanone, which is a synthetic thread material under the skin to stimulate better hair growth. We can add exosome therapy, which is a cell-free stem cell-like treatment, right? Curated from a laboratory using, as you mentioned, mesenchymal stem cells as a main cell line, and collect those exosomes in a laboratory. And we now have exosome products that have trillions of exosomes in a single vial. And we can apply that topically to the scalp using a device like a TransEpidermal Delivery device using sonophoresis.
Okay. So if you're going to do PRP, would you also be combining it with exosomes? And potentially peptides, or do you do standalone procedures, or how do you think about that?
Well, let's talk about the peptides and growth factors, because I have a great device and administration protocol for that. It's a brand new technology that we helped launch here in the United States, in North America over the past year and a half. It's called TED, TransEpidermal Delivery. That's a sonophoresis device. So it's a large device with a tiny activating head that vibrates at ultrasonic frequencies.
Okay.
So what that does is that breaks up the stratum corneum temporarily, so you can get big molecules through the skin. You know, the stratum corneum is what keeps you dry, right? Keeps the moisture in and the moisture out. It's the reason why when you step out of the shower, you don't expand like you have expanded like a sponge.
Right.
So our stratum corneum is kind of important to keep stuff out. But this device uses ultrasonic sound waves to disrupt the stratum corneum, which is a small, thin layer but has a tight junction, and so it disrupts those cell layers and the lipid barrier between, so we can push those really powerful peptides and growth factors through the skin with no needles and no pain.
Nice.
So,
okay.
So you mentioned copper peptide. We also use VEGF, FGF, and a thymosin beta-4 derivative directly through the skin during one of those treatments. So it's painless. It takes about a half an hour to 45 minutes, depending on the size of the area and the length of your hair. But no needles for the TED. That's great.
Right. Yeah, thymosin beta-4, we've seen some interesting effects with that with regards to taking people with gray hair and actually going back to normal color. So that's just using it subcutaneously, not in the hair at all. So
that's right. So we're getting some rejuvenation of color, and I think it's the magic combination of the copper peptide, so copper GHK, plus the thymosin beta-4 derivative, which they actually call proherin B4. It's a snippet of the TB4 molecule.
Okay, got it. Okay, interesting. So you're actually pushing those in with your TED technology, and then are people going home and injecting these or applying these at home as well, or is it's just done in the office and it's left at that?
You know, a lot of patients, they don't want to inject themselves, and I can understand that. I mean, those of us who are a little bit more aggressive with our, let's just say, biohacking methods, are used to that, more proactive, and it's not a big deal to inject yourself. But most of these men and women that come in for TED, they just want to do it once a month and see the results happening within about, if they're going to decrease shedding, that's going to happen the first couple of weeks, and then they're going to see better hair growth coming on 3 to 4 months later. It's going to be a really nice response and nice result. We've seen great results with the TED. And it's a nice adjunct. But there's no rule. You can do it with PRP if you want. You could have PRP this week and start a TED next week if you want.
Yeah, got it. Okay. And then, so, if you have all these different technologies, and I think what's really exciting for the audience to understand is that these technologies have gotten more and more and more effective, right? So, lots of the things that we're talking about are kind of standalone good, right? Whether it's red light, exosomes, peptides, PRP. I mean, these are, and when you start to layer them together, you're getting some pretty dramatic results is what I'm hearing here, right? So then the question is, well, who actually gets to the point where they need to have, follicles harvested? Is that a function of their starting point? Like there's just nothing to bring back, or is it a function of, what would get you to that point?
Right. So let's just say an average male, 30 to 40 years old, is noticing a receding hairline, but he's also thinning further back.
Sure.
So he's going to need a full tilt regimen to prevent his hair loss, because if he doesn't do anything at all, that situation is going to get worse every 5 years, 75% of the time, much worse. So if he waits 10 years, he's going to be much, much worse. And everybody has a different speed of acceleration, if you will, or loss rate that's genetically predetermined. And so he may need some transplants in the front. But remember, the transplants are immune to male pattern baldness. So that if he does the transplants, but he doesn't protect the other hair, he's going to need another hair transplant pretty quick within just a couple of years. That's not a good plan. And we don't like that to happen to our patients. So we're very, very proactive in getting the preventative therapies on board sooner and prior to any hair transplant.
Yeah,
so
that
with
makes
those preventative
sense.
So with those preventative therapies, is that an ongoing thing that they're going to need to do for the rest of their life?
You mean like exercise or brushing your teeth?
Yeah.
Oh, the answer would be yes, of course. I mean, if you stop taking care of your skin or your teeth or your brain or your muscles or your bones, entropy takes over and you will decay. And so if you care about your hair and you want to preserve it, and you feel like it's an important sign of youth and vitality, then, that's what we do. If you let it go, then it's okay. It's no problem. Then you've gotten past it. You've accepted it, and that's fine too. And so, but evolutionarily, humans are hardwired to make a snap judgment about a mate. Now, whether it's a male looking at a female or the other way around, we can make a snap judgment from across the room. That's in our lizard brain back there, so we can propagate the species and pass along the DNA to the next generation. And hair is just an outward sign, or could be an outward sign of our health and youth and vitality and therefore fertility. So that's why it's so important, and my dad's a dentist. He's still practicing at 55 years in practice almost. And we have that debate all the time, or whether you could see the hair or the teeth from across the room, and which one's more important.
Right. Yeah. So let me ask you this. Have you done anything to your hair?
What haven't I done? Well, what I haven't done yet is I haven't had a hair transplant, but my dad was totally bald. He needed 8,000 or more grafts to restore a full head of hair. So he needed a boatload of work. And his dad was totally bald. I never met the guy, my grandfather, with hair. My mom's dad also had severe hair loss by the time he went into his 60s to 80s. So I got it on both sides of the family, and I've always been paranoid about my hair. And I won't share with you the picture of me with long hair playing bass guitar in medical school. I'll spare you that. But the bottom line is that I've always loved my hair, and I always thought that I would lose it. But I never really knew what to do about it. But obviously, as we've described today, I've developed my own nutritional system for hair. I've developed my own hair care products, not just to soothe and decrease inflammation of the scalp, but also potentially for hair growth. I've worked on these modalities like laser light therapy, which I use routinely. Like I said, I have not had a hair transplant, but if I need one, I'll get one.
Where to go. Yeah, you know where to
go. I have an associate in the practice who's been in hair transplants for 30 years, and he's Hopkins trained, Dr. Jim Vogel, longtime friend of mine. And so I would trust him or another person that we've trained to do the procedure if I needed it. Most people don't realize I've lost 35% of my hair in the crown zone. And so hair styling takes care of a lot of that, and maintaining my existing hair with adequate caliber and length is a primary way that I keep that camouflage. So don't tell anybody. Okay.
Yeah.
Keep it to yourself.
Yeah, we'll keep it quiet.
Keep it quiet.
So, what's interesting though for the audience is to understand that, you're hearing about taking care of your hair from somebody who has a need to take care of his hair, not just a passion to take care of hair, but has an actual perceived need, desire, aspiration to take care of his hair, right? So if you're working with somebody like this, it's a little bit like working with us, right? I mean, how do you live young for a lifetime, right? Well, you have a VO2 max like you're in your 20s when you're, 69 years old. So, that's how you do it. And you want to be working with people that have that aspiration, have that need, because they're going to have all the tricks and tools to help you, quite honestly. So that's very, very cool stuff. So do you have any other last words of wisdom for the audience that you want to pass along?
Well, I would just say, as we've said, many times during our conversation today, that hair is an important sign of youth and vitality. And if you are experiencing hair loss out there, don't feel like it's a lost cause. If you've tried this or that or other things, maybe you didn't use the right vehicle or treatment regimen. Maybe you didn't do it for long enough, and so it may have been hard for you to judge the results. That's why we do so many detailed measurements. And even any therapy or treatment on its own could take 6 or 12 months for you to see the results in the mirror, if you're not measuring it with a microscope or something like that. So don't lose hope out there. Just get help is what we say. And so the hair loss process is not inevitable. It's optional, but take early action. And so whether it's with me or another board certified hair restoration physician, there's a lot of colleagues of mine out there who are doing some really great work. But don't sit on it and don't let it eat you up inside. If it's bothering you, it's okay. We can take care of it. For a man or a woman, it can be a very emotional organ when it's being lost, and also when it's looking great. You know how good it feels when you look in the mirror and everything is on point.
Yeah, great. Well, that's awesome. Well, we really appreciate you taking the time to share your expertise with us. It was a really fun conversation. So thanks so much for being on.
Oh, it's my pleasure, and I hope your listeners get a little snippet of insight as to what we do here at Bauman Medical, because we have a lot of fun here at the clinic in Boca Raton. And as I mentioned probably previously, we do connect with people from all across the world by home or by phone with virtual consultations and start the process on their hair journey.
Beautiful, awesome.